ask Minister Acheng. We are continuing our expose of world experience, and we're going slightly northeast to the Middle East. And we're calling on a man, he's a professor of 2 universities, and he's a Director General of Health Services in the Department of Public Health, Professor Waleed Ammar. Please take us to Lebanon.
Thank you. Let me start first with a few simple principles. Universal health coverage means that everyone, everywhere has access to needed health services without facing financial hardship. Who does what and how depends on the particular context and the history of each country. What is important is that the National Health Authority should fulfill its role of stewardship and have a system where every partner knows his role in order to hold everybody accountable. The National Health Authority is responsible to use national resources in the most efficient and equitable way to achieve results. And I'm talking about national resources, which doesn't mean government resources. It means government, non-government. It includes the resources of the private sector. Well, in Lebanon, as in many developing countries, we have a public sector with very limited resources. And on the other hand, we have a very powerful private sector, a private for-profit and a private not-for-profit. And the private providers are very well organized, they are powerful, and they have syndicates. And of course, health professions, they have also their syndicates, their associations, and their orders. So the question is how, with limited resources, you can deal with the diversity of these actors that are powerful and in a chronic context of political instability, and how you can overcome fragmentation and benefit from the diversity, because diversity gives flexibility to the system and enhances resilience. Well, the solution that we found, and it was developed over years, is that, well, in such a system, a hierarchical model based on command and control could not function with all these actors that are powerful and with your limited capacity. So the alternative is to have a collaborative governance that mobilizes 2 essential assets. First, strategic intelligence, that is a combination of scientific evidence, operational knowledge, and a deep understanding of the geography of stakeholders' interests. And this is combined with a process of networking and open and transparent collaboration. Well, as it was said, that the private for-profit is composed of, well, the private sector is composed of profit and not-for-profit. The for-profit sector is interested in curative care, secondary, tertiary care, and invests in technology, but also it is more and more interested in awareness campaigns and some health programs, such as screening. Whereas civil society organizations, they are heavily involved in health promotion and prevention, primary health care, palliative care. So these are the best allies for government in terms of promotion and prevention and primary care. Well, how do we manage the relationship with these partners? Well, the contracting provides a very interesting tool to engage private providers and to hold them accountable. And if you have a financial provider split, as we have in Lebanon, so you can use financing as a leverage to introduce reform, and you can introduce different kind of incentives to influence the provider behavior. Well, in the primary healthcare in particular, we have created a network of health centers. Most of them belong to NGOs. We have set criteria and we have set accreditation standards, and they should meet these standards. And at the policy level, the strategic level, we have a joint steering committee from the government and representative of the civil society. And we have a tripartite contracting. We have a contract, in the same contract with the NGO, municipalities are involved. So we have people representing the community that have an eye on what is happening. And recently, private clinics joined the system to perform, to implement certain programs such as screening and immunization. Well, accountability is important. The contracting provides, a tool for accountability, but also in the system, we had different kinds of accountability. We have the municipalities that are elected by the local community, so they are accountable to the community. The health center, which is accountable to the municipality and its own organization, the NGO, and to the Ministry of Health through the contract. And within the contract, we have two kinds of assessment. One that is related to the output and the outcome, because they are asked not to deliver services, they are asked to provide proof to improve the health of the community. And patient satisfaction is one important criteria. When we talk about private institutions, we should not forget academia. We have a strong relation with private universities that provide evidence for decision-making, that help developing accreditation standards and performance indicators and evaluation programs. At the end, well, I conclude with this. The private sector is there. Making the blind eye is no more an option. Regulation is key, but is not enough. You should engage with the private sector in a real partnership. Thank you.